All right, so looking to improve hip internal rotation through strength and mobility with these few exercises. So we're gonna start with lying on your back. So when we're talking about internal rotation, we're looking at the lower leg's ability to rotate outside of the hip with a straight femur or straight thigh bone here. So the ability to move into that position is important for hip health, the ability to squat lower. The ball has to be able to move inside the socket to be able to allow for greater squat depth and a healthy hip in general. So we'll take a position lying flat, and we're gonna bring one leg up so the hip is about 90 degrees and knee is at 90 degrees. And all we're gonna do is move gently just till you meet that kind of in-range barrier of where you feel like you can't really take it much further, and you're gonna hold there for about 6 seconds. And then you can relax back to center and then take it back out again. 6 seconds, hold and relax. And then we're gonna take it lower. So we'll be at about a 70-degree angle. Keep the knee right at 90, and then you're gonna do the same thing. It just switches muscle groups a little bit. Hold for 6 seconds again, and release. And out and hold. And release. Out and hold. And release, at least 5 to 6 times there. Then we're gonna drop it a little bit lower, so now we're at about 45, between 30 and 45 degrees at the hip range. Knee's gonna stay at 90, and we're gonna do it again. 6 second holds. And back to center. You're just monitoring throughout that your knee and your hip bone are staying in line, right? You don't want to be doing anything rocking and recruiting through the obliques. It's a very calm, controlled motion. Even if you don't have anything past this neutral range, the act of trying to make that happen is often enough. Relax. And then if you can come up past that 90-degree angle and do the same thing. This should be the last one in the book. Up and out. Again, 6 times, no compensation. Try not to hike and lean to make these things contract. All right? So we're starting at 90-90, dropping to about 70, and then dropping to 30 to 40 degrees. Internal rotation, isometrics. So after you've given the hip a little bit of a rest, we can then take it into active motion. So we'll come back up to maybe around that 90-degree position, come into your external or your internal rotation range, and then we're gonna actively move the hip. So maintaining this knee and hip position, you're gonna drop the hip and drive it up and around. So you're dropping and driving, right? We're not wiggling through, letting the internal rotation slip. Rotate, dip and drive. Abs are staying down, tight and pulled in, dip and drive, okay? Okay, maybe 8 to 10 on the rep scheme of that. Nice, slow, controlled motion. Remembering that this shouldn't feel awesome, but it also shouldn't feel like joint pain. It should really feel like the muscles through the front and kind of front back side of your hip are doing most of the work. You may get a little bit of pressure and pulling in the groin muscles. That's also normal, but no joint pain or decrease the range slightly. All right, so next piece is I want you to try to take a sort of Z-sit position. So if your knees will tolerate, we're gonna fold both underneath so you're in this nice Z. So we're looking at the right leg that's an internal rotation and the left leg that's an external rotation. So for purposes of this video, we're focusing on the internally rotated hip, but we're really going to do both sides. So if you need a yoga block or a blanket or something to sit on, if your hips just won't allow you into this position, you can certainly tuck that right underneath to decrease some of the pressure you feel through the joint space if your range just isn't there. Also be aware that you shouldn't really be feeling a ton of pain or pressure on the medial side of the knee either, because that can be a little bit compressive too. So if you're feeling a ton of knee pressure, you might also need to just tuck something underneath the hips. So what we're gonna do is looking at taking the knees out to a little bit wider of an angle, so we're not tucked in super tight, but we're opening up that angle so that the hip's gonna be right around that 90-degree position again, and the knee's gonna be somewhere between 70 and 90 as well. So to start with, you can take yourself over. So we're gonna decrease compensation this way. So you're gonna give yourself a nice base of support, and then we're looking to drive this foot up. And again, you're gonna hold for maybe 5 seconds, and then drop it down, and lift and hold again. So things that we're not looking for are gonna be as you lift that you're really cranking and pushing back through your spine, right? That's why we're gonna start here and see where the motion will allow you to be. And then as you feel more comfortable, like you're gaining more control, you can come up to a little bit higher of a seated place. Try again, it should get harder as you come higher. 5 seconds, relax, until you can make your way all the way up to the seated position here, and then lift. Even if you're not going anywhere, now your body understands the motion that we're trying to create, and all the contraction should be happening here and inside the inner thigh. A little bit of oblique work is fine. Again, we're just not looking to see a lot of compensation through the trunk, okay? And then we're gonna turn this into a mobility thing. So you're gonna actually reach out so that we're stretching over the left hip, pull up, drop it down, and then we're gonna come up and rock through this center plane and over to this other side, stretch through, pull up, come back, rock through the center plane, all the way up and over, stretch it down, lift it up, come up, rock through, up and over, stretch it down, and lift it up. Okay, so last piece of this is adding a little bit of resistance to the motion. So we're just gonna wrap a band right around the ankle and something to anchor it to. It doesn't have to be a high surface or anything insanely sturdy if your TheraBand isn't too tough. And you're just gonna sit. You wanna have, again, about that 90-degree angle at the hips, 90 degrees at the knee, however you need to situate yourself for that. And then we're just drawing the foot out and back in. Get out and in. So start with maybe 3-second holds on these because we've already crushed the isometric, right? So now we can move a little bit quicker, but still pausing at in range. Again, goal being hip and knee, right? We're staying here and spinning the thigh bone to create work in the hip, okay? You can then take it into a little bit more power, still controlling position. Good, give yourself a little rest, and then we can take it into a different angle. So you can drive the knee up. Again, not a compressive force, but maybe just a little bit past that 90-degree place, and do it again. Again, knee to hip or staying in plane, and relax. Drive it out, hold, and relax. Up, out, hold, relax. Okay. All right, that should wrap up internal rotation. Anything that causes knee pain,
Try to modify and find a more comfortable position, but without compensating through anything above hip level. Abs should be tight throughout all of it so that your body's active, but we're not looking to see a lot of movement through the abs and back.